President Donald Trump is calling for the CDC to overhaul the child vaccination schedule. Monday, he signed an executive order aiming to reduce the number of diseases children should be vaccinated against from 18 to 11. Those 11 include mumps, rubella, polio, whooping cough, chickenpox, and HPV. Vaccines for other illnesses like the flu, COVID-19, hepatitis A and B, and meningitis are now being placed in a category for high-risk groups or for parents and doctors to decide on together. The order also calls for the MMR vaccine to eventually be offered as 3 separate shots instead of a combined one.
It's not only that you're doing fewer vaccines or jabs, as they say, but you're doing them in a series of visits to the doctor, much smaller amounts.
The administration says the changes are intended to give parents more choice and bring U.S. recommendations in line with other developed countries. But major medical organizations nationwide are expressing concerns. So what does this mean for families here at home? Joining us live now via Zoom is Dr. Joe Ficori, president of the Michigan chapter of the American Academy of Pediatrics. Thanks very much for taking the time.
Yes, thank you for having me and bringing me on board.
So when you look at these federal recommendations, what's your biggest takeaway as a pediatrician?
I think with the executive order that was announced yesterday, I think the administration has doubled down on spreading some dangerous misinformation, truthfully, that can make our communities and children a lot less safe. And I want to sort of share with you what I would share to any parent that asks in the near future, sort of what this might mean for them. And what that means, and I can say this with confidence, is that right now the scientific evidence that supports routine childhood immunization is strong, and nothing new has changed to prompt what this executive order suggests.
Why is the timing of a vaccine so important?
So the timing of how the current recommended schedule from the American Academy of Pediatrics suggests vaccinations for young children is based on decades of research amongst thousands upon hundreds of thousands of studies that have occurred. And the timing is crucial based on when children are most susceptible to significant diseases and conditions that could be most harmful. And when we provide recommendations related to vaccine schedules, the recommendations are based on when the child is most ready to sort of build that response based on the immunization, the intended immunization.
What can happen to children if they don't get vaccinated at the recommended age?
So, I think that right now we're living in a time where measles cases, for example, are surging in the United States. We're seeing more cases in 2026 than we have in the last 30 years. And we have a lot of vulnerable populations. We have a lot of young children in our country. And when patients may not follow the recommended schedule, that does increase the risk significantly for contracting some of these conditions that may be significantly debilitating, might lead to increased hospitalizations, and unfortunately sometimes lead to death. And that's why we work towards preventing what we can prevent with the current recommendations.
Doctor, separate MMR shots are not currently available in the U.S. right now. What does that part of the order mean for families and pediatricians?
Yeah, so, the executive order does sort of call for a task force to address exactly that, amongst many other things. And I think the greatest concern that we have related to that is, as these were phased out back in about, I think it was 2009, we don't have these available currently in the United States. And so to truthfully get to a point to where that may or may not be something that we would recommend, we're going to need, again, decades of strong, credible scientific research to help support that is both effective but also safe for us to be recommending. And so, whether or not that is something that, we can do immediately, that's unfortunately not something that can just happen overnight. And so I think it only reinforces that what we stand by and support is exactly the strong evidence that we currently have recommending what we are recommending through the American Academy of Pediatrics.
All right, doctor, thank you very much for your time tonight. Appreciate it.
Yes, thank you for having me.